My name is Lily Chen. We'll start over again. On behalf of United Chinese American UCA National and UCA Illinois chapter, we would like to express our sincere thanks to the incredible planning committee led by Ms. Ren Lee, our UC Illinois board member and also president of Cornerstone Education, also for your entire staff. Also Dr. Wei Yang Xie, and licensed clinical psychologist and also UCA's expert consultant. Tim He, our amazing technical magician. And thanks also to Paul Lee, our UCA board member and the founder of Kelvin Jia Lee Foundation. Thanks also go to Hai Pei Xue, UCA president, as well as countless passionate UCA and UCA Illinois board members, volunteers, and community members for the past 3 or 4 years for helping us bring the awareness of mental health to our community. Sincere thanks also goes to our other webinar partnering organization, MGH Center for Cross-Cultural Student Emotional Wellness, and Youth Voices, and NIC Network of Hope. Of special note, thanks to the Naperville parents and advocates who reach out to us after a tragic loss of a very young student. And last but not least, a thank you to all of you taking your precious Sunday afternoon time to join us and learn with us. And Tim, if you can show the slides of some state representation, here we go. We have registration 770 half an hour ago and from 34 states. And most of you registered through WeChat. And without further ado, here is Dr. Xie, our webinar host and moderator. And thank you so much for your incredible work and your passion.
It's my honor to be here to be the host and moderator for this webinar. This is a very important topic. Many of us probably know when it comes to mental health problems, we Asian Americans may have lower rates of psychiatric diagnosis, but more severe cases such as suicidal thoughts and attempts than almost all other racial and ethnic groups. However, Asian Americans are among the least likely of all racial groups to utilize mental health services and receive treatment. And some of those are unique to our cultural upbringing and how we view mental health problems. So today, we would like to focus on one of the mental health issues, depression, and also suicidality, suicide. Depression is one of the leading causes of suicide. And then we would like to talk about strategies we can use to prevent and to intervene in a timely manner. So allow me to introduce today's agenda first. So we will start with a short poll. These questions will help guest speakers better understand your needs during the webinar and also for you to assess your knowledge and also your knowledge change about this topic throughout the webinar. We're honored to have 2 guest speakers today join us today. And Dr. Juliana Chen is the child and adolescent psychiatrist. Ms. Linda Pesha is a parent advocate. We're also equally delighted to have 3 student panelists join us today. They will also share their firsthand experience with struggling with mental health issues. And one of the student panelists, Sandy, actually was featured in the video we just watched. For some of you who may not get a chance to view the video talk about the struggles that Sandy had when she was dealing with mental health issues, and also the support his parents provided to her, and also this journey, the challenges they have had during this journey. So it raises our awareness to deal with mental health issues. And then all of our speakers and panelists will join our Q&A. And if you have any question during this webinar, please feel free to type those questions in our chat box section. We'll have one of our committee members, Dr. Pauli, will monitor all of that, and we'll compile them together and present it to our speakers and student panelists towards the end of this webinar. And then we will wrap up with another polling and also end this webinar today. So let's start with pre-webinar survey, also pre-webinar polling. All of the questions we're asking you today, they are going to remain anonymous, and it's optional to fill out. And we will be able to show those to our audience anonymously as well. So the first question is that I'm familiar with depression symptoms in children and adolescents. The second question is, I am familiar with professional resources that can help my child with depression or other mental health issues. And the third one is, as a parent, I know how to effectively support my child with depression or other mental health issues. I think the first question, most of the people answered neutral. I'm familiar with depression symptoms in children and adolescents. And that's one of the focus we're going to have today. And hopefully that after this webinar, you will get more familiar with depression symptoms. And the second one, the most answered question is, answer is also neutral. I'm familiar with professional resources. We'll definitely talk about that as well during our webinar. The last question, as a parent, I know how to effectively support my child with depression and other mental health issues. And we also get the neutral one, follow up with by disagree as the second, and agree the third. All right, thank you for all of your sharing. So without further delay, I would like to introduce you our first guest speaker today. We're very lucky to have her join us, Dr. Juliana Chen. Dr. Juliana Chen is a child and adolescent psychiatrist. She's also instructor at Harvard Medical School, and she's the associate director of the Massachusetts General Hospital Center for Cross-Cultural Student Emotional Wellness. So welcome, Dr. Chen.
So thank you, Wei Young, and thank you to UCA and everyone involved in planning today's webinar. It's truly an honor to be here. As Dr. Xia mentioned, I'm a child and adolescent psychiatrist and part-time instructor at Harvard Medical School. And what that means is I see kids and teens on a daily basis in my clinical practice, and I work very closely with parents to help them support the emotional wellness of their children. And just to share just a very little bit about me personally, I'm a second generation Chinese American. So my parents immigrated to the US. My brother, sister, and I were all born and raised in the Boston area. And some of you may know my film, Looking for Luke, which we have screened across the United States to help decrease stigma and break the silence around depression and other mental health issues, in particular in the Asian community. So today's webinar topic is very close to my heart. Personally experiencing the unique stressors of growing up as an Asian American student and as a child psychiatrist, knowing the prevalence of mental health disorders, and really truly very infrequently seeing Asian American students present for mental health evaluation and treatment. For these reasons and so many others, I was inspired to make Looking for Luke, and it's also why I talk with parents during events like this. So I so appreciate the opportunity of joining all of you today. But in the brief time I have, I hope to share a broad overview of youth mental health and depression, highlighting the unique risks that Asian American youth face. And then we'll talk briefly as well about treatment options and what parents can do to support kids and teens. So just jumping in. Intro. So first and foremost, this is very, very big picture youth mental health information. Parents should know that mental health issues are extremely common. 1 in 5, this is both adults and in children ages 13 to 18, individuals will currently have or have had a significant mental health disorder in any given year. So we care especially about kids and teens because, as you can see here, the majority of mental health conditions actually begin in childhood. 50% by age 14 and 75%, by age 24. And this does not at all match up with the percentage of kids who are in mental health treatment. So just think about these numbers for a moment. When we talk about mental health disorders in youth, most commonly we are talking about things like anxiety disorders, behavioral challenges, ADHD, mood disorders like depression, which we're going to talk about today, and substance use disorders. I just want to highlight a couple of things. So first, anxiety disorders. These are one of the most common disorders we see. This manifests generally in early childhood. And social anxiety in particular has a high prevalence among Asian American youth. Mood disorders like depression, though they can occur in younger children, they generally first manifest in early adolescence after the onset of puberty. So some things to keep in mind is that anxiety is itself a risk factor for later depression. And there's evidence that both anxiety and depression are steadily on the rise in today's teenagers. So knowing, some familiarity of both of these conditions is really important. In addition to knowing how common different kinds of mental illnesses are, which can hopefully help decrease stigma that is so pervasive in our community around mental health, it's also important to know that mental conditions like depression are treatable and in some cases preventable. So this is really one very simple takeaway I'd love for parents to have from today. So for kids and teens who are struggling or at risk, early identification and mental health treatment are key. Now, looking more specifically at depression. So put very simply, depression is a medical illness. It negatively impacts how you feel, the way you think, how you act. And just like other medical illnesses, like heart disease or diabetes, depression is influenced by a combination of things that we call biopsychosocial factors, right? So what this means is you need a combination of things to all happen together to line up just right. Things like genetics, brain chemistry, temperament, physical health, trauma, stress. Together, these place people at greater or less risk than others. To diagnose depression, this is just how we think about it as a clinician. We look at a constellation of symptoms based on what's called the DSM-5. And so according to the DSM, this is a diagnostic manual, a child or teen or adult needs to have at least 2 weeks of what we call persistent mood change and or loss of interest or pleasure in doing things with some combination of these other symptoms. So sleeping or eating more or less, feelings of guilt or worthlessness, things like low energy, poor concentration, difficulties with motivation or thinking, and sometimes hopelessness or thoughts of death and suicide. What's most important for parents to know, because I think most of you with us today are parents, is that we have this neat list of symptoms. The reality is not all depressions are the same. So in movies and TV shows, oftentimes depression, I think, is portrayed with, lots of crying and sadness, or people who aren't able to get out of bed or function. And for some people, this is true. This is what their depression experience is like. But depression, the reality is much more varied and complex. So what depression might look like, in teens especially, rather than sadness or crying, depression more often manifests as irritability. Depression could also look like things like anger, troubles with focus, energy, motivation, or social withdrawal. It could come across as irresponsibility, forgetfulness, physical symptoms like headaches or fatigue. Depression can also look like things like missed homework assignments, fallen grades, more time on screens. And more severe depression, as I mentioned earlier, could include things like suicide thinking and self-harm behaviors like cutting or substance use. And then I also want to mention, lastly, not to scare all of you, but on the surface, for some kids and teens, depression may also look like everything is fine, meaning we don't know that a child is having a hard time. This is what has been referred to as the duck syndrome. This was first coined at Stanford University. And it's a silly metaphor perhaps, but it's this idea that if you look at a duck swimming on the pond, ducks look so calm, gliding effortlessly perhaps on the top of the water surface. But if you look underneath, in reality, we don't know how hard that duck is paddling to stay afloat or change direction. And so that is to say that if a child or teenager is not exhibiting big problems or they're getting good grades, that things like this are not necessarily perfect indicators for how a child is doing. This is also why having a positive parent-child relationship and a home environment where things are talk-aboutable are so, so, so important. So our children know that they can come and talk with us when they're struggling, but also that they can talk to us with whatever it is that they're feeling or experiencing. The big takeaways here I want you to have is that depression can look like a lot of different things. Sometimes it can be hard to see. It can range from mild to severe and cause significant suffering. It can absolutely impact things like relationships, learning, school performance, self-esteem, and self-worth. And in the most tragic of cases, which we'll talk a little bit more today, depression can sometimes be fatal. So know that if you have any concerns about your child or teenager, regardless of whether you know for sure if it's depression or something else, And especially if there are any safety concerns, your child really, really needs your support and would likely benefit from some professional help. Really quickly, for those of you who like numbers more, some depression information. The prevalence of clinical depression in kids is about 2%. In adolescents, this generally increases to anywhere from 6 to 13. Girls are at greater risk than boys, and the risk for depression increases, as I mentioned earlier, in adolescence. There are a couple of groups at particular risk. So kids with anxiety are 2 to 4 times more likely to develop depression as teenagers. So we really want to look out for those kids who run anxious. And also because of negative attitudes and cultural stigma, LGBTQ plus teens are especially at risk, 6 times greater risk. So this is another extremely vulnerable population of kids. Overall, the 2 strongest risk factors for depression in kids and teens are family history of depression and exposure to psychosocial stress. So I'm perhaps stating the obvious here, but we obviously can't change genes or family history. But the good news, and I do think this is good news, is that parents can decrease a child's risk for developing depression by knowing what to look for, supporting and listening to their kids, and helping to decrease the amount of negative stress our kids are experiencing. And you should know there's lots of evidence these days pointing to the fact that kids and teens are experiencing higher and higher levels of stress overall. So decreasing stress really matters. Individuals with depression, you should know, are also at significantly greater risk for suicide and self-harm. Suicide right now is the 2nd leading cause of death among adolescents ages 15 to 19. So helping those who are struggling is critical. Very briefly, there's been a lot written about the unique mental health risks of Asian American youth and how they're struggling often in silence. Dr. Shia mentioned this in her beginning introduction. Briefly, we know Asian American high school and college students have high rates of depression and social anxiety, as well as higher rates of suicide thoughts and suicide attempts compared to their peers. And though this is not tracked nationally, there is individual college data to suggest higher rates of completed suicide among Asian college students. And Asian American students, as Dr. Shia mentioned, in comparison to all other racial ethnic minority groups, are among the least likely to seek out and receive mental health treatment. And so this is a dangerous combination. And this is in part due to significant mental health stigma in the Asian community. Point being, Asian American kids are struggling and they are vulnerable. There are so many stressors. I think we could spend a whole webinar on this, but just really, really briefly, based on my clinical experience and conversations with students across the country at film screenings of Looking for Luke, some of the stressors Asian American youth are experiencing, things like pressure to live up to the model minority stereotype, pressure to live up to parental expectations for success or academic career, students feeling like they always have to project success and achievement, either via social media or what is called on Harvard campus Harvard Face. Students describe real stigma and shame around mental health, especially within their families. This is that silence that we're talking about. They also talk about the challenges of having a bicultural identity, so growing up both Asian and American, and feeling sometimes very strong family obligations due to the sacrifices their parents have made. Increasingly, and especially in recent months, students have been sharing more and more stress related to racism and anti-Asian sentiment in the context of COVID-19. And above all else, I want to share with you that something that I hear from really all kids and teens, but definitely as well Asian American kids and teens, is that in particular, the ones who are struggling, they share again and again, forgive me, how much they really want to talk with their parents, and yet how hard it is to talk with their parents. So that their parents don't understand mental health or stress or depression, that they don't really listen or understand, but that they really, really want to talk openly and honestly with parents. So please know, even if it doesn't feel like it, your children and teens are wanting to connect with you. In terms of treatment, again, there's a lot that we can be said here, but very quickly, the good news is that depression, like other mental health illnesses and like medical illnesses, they're treatable. So depression is usually treated with psychotherapy, medication, or combination of the two. For mild to moderate depression, the gold standard treatment is therapy alone. So this is talking to someone like a social worker or psychologist, or in some cases a psychiatrist. For more severe depression, the gold standard treatment is combination therapy and medication. And just briefly about medicines, the first line medicines we use are medicines called SSRIs, selective serotonin reuptake inhibitors. These are commonly called antidepressants. They're medicines that people take once a day. They're also used for things like anxiety and OCD. They're not necessarily, in particular for kids who are new to psychiatric medication, not necessarily medicines that they're going to be on for forever. I talk with parents about thinking about these medicines, of things that kids and teens may be needing now to help them get through a difficult time. And you should think about, if you're going to do medicines, think about these in terms of months or a year or longer than a year. These are not medicines that you use just for days or weeks. They can be started easily. They can also be stopped easily, particularly if someone is new to them. It can certainly be harder if someone's been on these medicines for a long time and at high doses. This usually isn't the issue for most kids and teenagers. Parent and family support are also tremendously important, with parental support being one of the strongest protective factors against depression and suicide for teens. And other really important ways to protect against and help our kids and teens who are struggling in any way with mental health issues: decreasing stress, as I mentioned earlier, healthy habits like regular sleep, healthy eating, physical movement, time outdoors, as well as things like mindfulness and self-compassion and positive coping strategies. These things really make a difference. And to close up, what else can parents do? So notice what's going on in your children's lives, not just with school, but also their emotional and inner lives. Monitor, notice mood and behavior changes, and watch out for family conflict and too much negative stress. These things can really take a toll on kids and teens. I'm always encouraging parents to talk with your children and teenagers, really talking with them, not at them or to them. Have an open heart and mind, validate their thoughts and feelings, even if you don't necessarily agree with what they're saying, and be compassionate. Recognize that success is not only academic achievement, but also just as important, and I would argue perhaps more important, is emotional wellness. And if you ever have any concerns, please don't ignore the concerns or worry by yourself. Seek professional support and guidance. During the school year, many parents don't realize you can talk to the school counselor. And also many parents don't realize that most, if not all, pediatricians should be able to help with something like this if you have any concerns at all. And a pediatrician can help refer to a mental health clinician if needed. And most importantly, these last words are inspired by a Chinese mother who joined us for our last webinar a couple weeks ago. Love, listen, and learn from your children. There's so much they can share and honestly want to share about how they are feeling and doing. So really listening strengthens the parent-child relationship. It lets children know they are safe and loved emotionally. And this is also protective against mental health challenges. So these are all good things. Dr. Xie had mentioned some resources. I think we'll be sharing these as well in the chat bar. But before we move on, just want to share some important resources for families. Psychology Today is a really wonderful resource if you're looking for a therapist. It's a directory that's national, it's free. Also, as I mentioned before, you can speak with your pediatrician. NAMI offers educational and peer support resources. And then we'll be talking, I think, about suicide risks in just a bit. But wanted to mention there are numerous crisis hotlines, text hotlines. These are available 24/7, as well as the last resource there is available internationally. Our center at Mass General Hospital, where I'm associate director, we don't provide direct clinical care, but we offer educational resources and are always happy to speak with parents or schools about, if a child is struggling, or mental health resources, and we'll do our best to help in any way that we can. And parents are also welcome to contact me with any questions they may have. I know we'll be talking more, but really just want to thank everyone for being here and wanting to learn more about supporting kids and teens. That means a lot, and webinars and conversations like this are one incredible way we can really make a positive difference. And we'll be talking more, I know.
Thank you, Juliana. Thank you for sharing your expertise with us. I'm sure that many of our parents probably have questions for you. And so feel free to post your specific questions in the chat box for Dr. Juliana Chen if you have, and we will answer them towards the end of our webinar. And now let's introduce our next guest speaker, Miss Linda Pesha. Linda is a suicide loss survivor. She lost her son to suicide several years ago. And since then, she has been an advocate, public speaker, and writer to help us increase mental health awareness and prevent suicide, and also discuss loss and grief issues openly. So very lucky to have Linda join us today as well. Linda, welcome.
Well, thank you very much for having me. I really appreciate it. I'm a mom of 2 children, one of which grew up having difficulties socializing with his peers. He was bullied and then eventually suffered from depression that led to suicide. Today, I'd like to share with you some of the things that I learned through that experience so that you can then take those things home when, when loving and helping your children. The first thing is that it can happen in any family. Suicide can happen in any family. I certainly didn't think it was going to happen in ours. There were no major red flags. As Dr. Chen said, my son was one of those ducks. He must have been pedaling very hard underneath the water, but above that water line, it looked like everything was just fine. In our family, there was nobody doing drugs. There was no heavy drinking. Nobody was putting down anybody or lowering self-esteem. We paid attention to our kids, and we also, we were good parents that looked out for their social well-being, their emotional well-being, and their spiritual and academic well-being. My son was 19 years old. He started college with almost 1 full year of credits, and he was just a terrific kid. We lost him 2 weeks right before spring finals. He was a freshman at college. Now, it can happen in every family, and I don't want to scare you that way, but the good news is that suicide can be very preventable many times. What you need to do is learn the risk factors and the warning signs. I wish I would have done that. I wish I would have known that. I knew some of them, but I wasn't familiar with all of them. So where can you find them? Well, Dr. Chen just gave you a bunch of them. You could go on any computer through any search engine and just search for risk factors and warning signs, and a bunch of them come up. If you go to our website, Nick's Network of Hope, we have the risk factors and warning signs on there, many of them, as well as informational links to local and different national organizations. I also have one more resource for you. I just wrote this book that just came out in May. It's Saving Ourselves from Suicide, Before and After, How to Ask for Help, Recognize Warning Signs, and Navigate Grief. I wrote this for people who are struggling, for people who have gone through suicide and going through the grief process, and for anybody who wants to help any of those 2 categories of people. Why I am referring this resource is because together with those lists of risk factors and warning signs, I actually give you real life examples. I give you my son's last text messages, and I put them out. I bold and label what the risk factor or what the warning sign was, so that you will have those at your fingertips. All net proceeds from that book go back to suicide prevention. You can go to our website and see all the buying options there. The other point I would like to make is that, as Dr. Chen said, the most important thing that you can do is listen to your children. Ask them open-ended questions. You know, so often we go to our kids and we ask them a question just to hear what our call of action is, what they need us to do for them, and then we fix it. But we need to sit down and ask them those open-ended questions like, how are you feeling? What types of things are you experiencing at school? What kind of pressure are you under? Are you under pressure? Am I exerting any sort of pressure? What can I do to help you? And then sit forward and listen to them. Open the lines of communication. You may not like some of the things that they come back and say to you, but again, you need to open the lines of communication and understand what they're saying is what they're feeling, and you just need to listen. The second thing is, if you think that your child is doing more than just being in a glum mood, and you can't really see a quick end to it, like it wasn't just a quick breakup with a boyfriend or a girlfriend or a death of a pet or something like that, if it's going on and lingering, then it is okay to ask them if they are having thoughts of harming themselves. I didn't know this, but the research has shown that you will not be planting the seed and you will not be giving them the idea to hurt themselves. So open those lines of communication. It can save their lives. Now, the other thing is, like I said, my son died just 2 weeks before spring finals. And my point is, do not be a cheerleader when people need more help than that. When I saw my son, I flew out there when he said he was having some problems, and I was a cheerleader. I said, oh, I called him Snoopy. That was my nickname for him. Snoopy, you're almost done. 2 more weeks, you can get through finals. And then when he came home, I was going to bring him to a mental health professional. Well, I didn't have that luxury. So when you see something that is alarming to you, that isn't just a glum mood, then don't try to cheer somebody through that pain. Go get professional help. And I like to equate that sometimes with physical health, because mental health sometimes is kind of scary. We can't really wrap our brains around that, but we're familiar with physical health. We understand that. So if your child had a cold, you can take care of them at home. You can make them soup, you can help them. But if they have pneumonia and they're coughing up blood, none of you would think of handling that alone at home. What would you do? You'd pick up the phone and you'd bring them to the doctor, right? Well, this is the same thing. If it's more than just a sad mood and it's something that's lingering on, go get help. You wouldn't feel embarrassed to bring your child to a doctor for pneumonia. So don't feel embarrassed to bring them to a psychologist or a psychiatrist. It's just as important and can be just as life-threatening. The next point is, sometimes we must believe the behavior more than the words. Now, what do I mean by that? You may ask your child, hey, how are you doing? I noticed that you seem depressed. You seem like you're not sleeping right. You seem moody. They may look at you and say they're fine. Well, they may not be lying. They may, first of all, think that they really are fine. Secondly, if they don't think they're fine, they may tell you that they're fine because they don't want to be a burden. Maybe you have other kids at home and they don't want to put something else on you. So if everything is pointing in the direction that is alarming you, that, like Dr. Chen said, all of those warning signs where they seem depressed, go get professional help. Believe the behavior more than the words. It sounds counterintuitive because we want to believe our kids at face value when they say that they're okay. The next thing, and I would be remiss to say this, is that, my son went away 6 hours to school. And so I have to say this. If you have a child who is having difficulties going through the normal life challenges that adolescents are going to, and you're concerned, now, I'm not saying be an overly protective parent. I'm saying, like, you have valid concerns, then my recommendation from parent to parent is that, if they go away for a job or for school, then it would be nice if they were a car ride away, or they have somehow some family members that can check on them. I wish we would have done that with my son. He was 6 hours away, and I think that lack of support system of having us there, seeing him on a more regular basis, made a difference. So these are the top things that I learned, that I hope now that you can take them and share them with your kids. Thank you.
Thank you, Linda. Thank you for sharing your wisdom and your experience. And Thank you for being so generous sharing your story. I know it can be triggering sometimes, so we're really grateful that you can share those with us. We're grateful to have you, as Xiaohong mentioned, and also Linda mentioned, and Juliana mentioned, listening to our kids is very, very important. That's why we have 3 student panelists join us today. We would like to hear from them their story with mental health issues and hear from them what they would like our audience, our parents know. So I would like to introduce Sandy, Lo Yan, and Tim and to join us. And I'm gonna have them introduce themselves because I believe that it will be good for the audience to hear their own words and get to know them more personally. Okay, no specific sequence. Feel free to choose who would like to speak first. Welcome.
Hello, everyone. I'm very glad to be here today. My name is Tim He, and I am 26 this year. I suffered from anxiety and depression through most of my late teens. And even today, I still have to deal with it, and I'm still taking medication for it. I have to thank my parents a lot for helping me through that time, but also especially my friends and my support group and my community who I was able to lean on in my darkest of times, and especially my little brother, who I do many things with, was a very important person to me.
My name is Leanne Gould. I am 15. I'm a rising sophomore, and I was never actually diagnosed with depression or any of these things, but I have gone through some symptoms. But more than that is that I had a lot of friends that suffered from very severe depression and anxiety disorders, and I was more of like that friend that they went to talk about their feelings or how they felt or like their suicidal thoughts and things like that. And I was the person who encouraged them, talk to your parents, like find someone professional to get some help. And I continue to do that. And I've had them like hospitalized, and I was always the person to visit them in the hospital when, you know, they were at their lowest. So I'm more of like a confidant, these things.
Hi, everyone. My name is Sammy Chen, and I'm 21 years old. I've dealt with depression and anxiety ever since I was in middle school, and it's gotten pretty bad at times. I have attempted suicide several times, and I'm just grateful to be here today and share my story and hopefully help others along the way. Thank you.
Thank you, Sandy. So one question that people usually are wondering is that, as Dr. Juliana Chen mentioned, there are a lot of factors, biological factors, psychosocial factors, and also unique cultural factors that contribute to the developmental mental health issues. So I would like to hear from all of you, what do you think are the factors that make Asian American teenagers more susceptible to depression from your personal experience?
I think one thing was kind of the pressure that is put on you to succeed, because you do know how much your parents have sacrificed for you. I mean, because we moved here when I was 6, and my parents have just been working nonstop to provide the best that they can for me, and spent so much money on me in my education and in the things that I've done. So when it came to a point where like I wasn't able to get somewhere I wanted to, I felt like I couldn't live up to the expectations and like everything that my parents did for me, and that kind of started a spiral for me. In being able to just deal with anything daily.
Thank you for sharing, Tim. It's similar to what we shared, the model minority stress, that we have to live up to certain academic achievements, that expectation that seem to be the external stressor for you. Okay. How about Loyan and Sandy? How's the situation like for each of you?
Well, I'm only half Chinese, so, but unfortunately, my father passed away a long time ago when I was about 8 years old. So I have been living with, my father was American, and my mom is Chinese. So I've been living with my mom ever since, and it's just me and her at home. And a lot of the times, a lot of Asian parents push for like doing academically well, and it doesn't mean that they don't care about your emotions or things, but a lot of them expect that you be successful. A lot of times, like the stereotypical, they want you to be like a lawyer or a doctor or something along those lines, and they would hope that you would go to like an amazing college and like meant like these professional degrees. And also just like the expectation of other kids in schools, a lot of times I was confronted if I didn't get maybe like a grade that I had hoped to get on a test or something. I'd have other kids like come up to me and like joking around saying, well, you're Asian, you're supposed to have like 100%. And then they would say, oh wait, you're only half, so you're obviously like dumber, or they say something like that. And that's not true at all. Everyone's different and everyone has their own places where they're better at. Some people might be better at math, some might be better in the arts or other things like that. And it's important to know, like, although academics is important, if like your child is struggling with their mental health, definitely put that in front of academics, because there's no way that I think that you could succeed academically when it's hard for you to like just get out of bed or do something as simple as like those things, rather than like getting amazing grades and things like that.
Thank you for sharing. That's a good point. It's not only about academic performance, it's more about our psychological well-being. And also I heard one unique thing about you, Loyan, is that the bicultural identity you're having, sometimes that how to navigate between those can be a stressor for you as well. Thank you for sharing. And Sandy, do you have anything to add?
Yeah, so I think one of the main things that made me feel inadequate when I was growing up was that my parents would always compare me to other people. Like my cousins or my older sister, they would always say like, "Oh, your cousins and your sister, like they're doing so well in school. Why can't you just keep your grades up like them?" Or, like they look a certain way. Why can't you look like that? And so I think, along with like the model minority myth, there's also a lot of comparison that goes on in our culture. I know that it's not just me myself. I know like a lot of my friends have went through it as well with their parents, where they feel like they're never good enough, and like they feel like they can never like satisfy their parents' wants or their needs. And so then that just leads to like a lot of self-doubt and like a lot of low self-esteem. And so I think just comparison, along with the pressure to always exceed in school and other aspects of life too, contribute to depression and anxiety.
Yeah, that's another good point. A comparison. Many of my students or client also mentioned something similar. I think when we compare, there's also assignment of judgment, and judgment can be hurtful. Right? Judgment can make people internalize things and form negative self-perception. A lot of those we know that are associated with depression or developmental depression. Yeah, thank you for sharing. And another thing that we're also curious about is that what are usually the barriers from your experience? Are the barriers that prevent you or your peers from reaching out for help? We heard parents saying their kids don't want to go, or they heard saying that they tried, it don't work. So there are many reasons. We're curious from your perspective, what it's like.
Well, for me personally, I think one of the issues with my family is that, well, I'm first generation, and so my parents and my older sister, they're very they well, my parents mainly know how to speak Chinese. They don't know that much English, so there's always a language barrier between me and them. And so it was very hard for me to communicate how I was feeling most of the time. And oftentimes, like, I would just rather give up than convey to them how I felt. And I know in the video I also mentioned that like there were a lot of times where I felt like even if I did tell them how I felt, they wouldn't understand me, or they would judge me. And they would also just call me like lazy, or just like they would say that I was being weak. And so I think like when they would say stuff like that, that would just make me want to shut down even more.
Yes, you feel invalidated.
There were times where I I kind of wanted to share with my parents more about things I was dealing with, but for some reason I just couldn't actually force myself to. It was just something like I talked with my parents about basically everything, but just my mental health and how I was doing was just not something that I for some reason felt comfortable talking with them about, which is, I don't know, weird, because I talked with them about almost every aspect of my life. Um, and it wasn't until I think I started taking medication and started seeing a therapist where I was more open to actually talking to them about how I felt. For me, it was a lot more helpful for me to talk to like friends who've had similar experiences, or other people who have like suffered through depression, and being able to open up and talk about it that way.
Thank you, Tim.
For me, so me and my mom went through a lot together, obviously with like my father's death, and we don't really have too much other outside family with us. So it's really just me and her. And I know that my mom worked extremely hard to make it to this country. She is disabled, so she definitely faced a lot of, like she was held back a lot in China. So she had to work like twice as hard as a lot of other people to make it to this country. And I know that I tell my mom like everything. I tell her about all like the so-called drama that goes on in school or all these other things. But a lot of the times I also, if I was struggling internally, I wouldn't tell her, because I kind of wanted to like stick up for her, and I wanted to be like, I'm like great, I'm doing fine, and I don't want to be another one of your stress factors, and I don't want to make you feel like you failed in raising a child. um and for a lot of times when I was talking to my friends about their suicidal thoughts or whenever, a lot of them, they felt like they were neglected by their parents just like, if we give you money, if we give you a place to sleep, if we give you food, that's enough. We don't need to talk to you. And a lot of times I remember I was in the hospital with a friend, and she didn't even want to look at her mom. She didn't want to see her mom because she was so convinced that her mom did not care about her, when in reality, a lot of the times her mom just did not know how to communicate with her and express the feelings. Because I feel like talking about mental health and those things are like more of like a thing that we like people don't usually talk about in Chinese culture and a lot of Asian cultures.
Yeah, that is so true. I think a lot of what you shared is related to our Asian American cultures or Asian cultures, that mental health problem is still a taboo to share, to talk about. Even we do, and we lack that vocabulary to really have a productive communication. So this leads to my next question for three of you is, what have you found that helpful or not helpful when you talk to your parents about your mental health issues? What they have said that you found helpful or not helpful?
I think the most helpful thing that my mom did, and my mom did, was just um, being completely non-judgmental about the things that I do. Being completely supportive and just be like, I've got you. It doesn't matter what you do, what you want to do. I'm gonna be there for you. And she kind of took a step back and let me find when I was comfortable to talk with her. But she always incorporated more like family time, of us spending time together with our entire family, whether it being just cooking or playing a board game or just like sitting outside on the porch, something like that. I think it was very helpful for me.
Thank you, Tim. So I heard the keyword non-judgmental and being unconditionally supportive. Thank you.
So my parents have come a long way in their understanding of mental health. I think one of the least helpful things they've done is like when I first started showing symptoms of depression and anxiety, they just didn't really understand it, and so they took me to my pediatrician, and she recommended that I go to a psychiatrist. And I remember I was in 8th grade at the time, and when we were going to see the psychiatrist, my parents tried to talk me out of it, and they were just saying like, oh, like, you don't need to do this. you're so much better than this. Like, you can't be depressed, you can't be anxious. Like, and they were just putting a lot of pressure on me to not feel the way that I was feeling. And so this led to like me internalizing a lot of my feelings and just bottling up my emotions. And I remember I talked about this a little bit in the video, but I remember the first time I tried to commit suicide. My parents came home and they found me on the bathroom floor, and I was pretty much almost unconscious. And they got pretty angry with me after I told them what I had done, and they refused to take me to the hospital for the next, I would say, 8 hours, just because they were ashamed of what I had done. And I think that's probably one of the things that they've done that's hurt me the most, just because I felt like I was in such a dark place, and like they weren't able to see what I was going through, and they were just very adamant on pushing it under the rug or sweeping it under the rug. But I will say that they have come a long way since then, and I think one of the most helpful things that they've done for me is they give me space, and so like they know, so like they'll tell me that like if I'm ready to talk to them about what I'm going through, then like they'll be there, but they don't force me to talk to them about it. They don't pressure me to come to them. They just let me know that they're ready for me whenever I'm ready.
Thank you for sharing, Sandy. I think that's so true. I think giving students, kids, the space to process their emotions, and instead of judging it or dismissing it, I think that's very important. A lot of parents usually tell me that I want to talk to my kids, but my kids don't want to talk to me. And the first thing from this webinar we have talked about today is, have you started listening yet? Have you started giving them space and for that emotions to be there before you talk to them? So I think those advice you two shared are so important. Last but not least, Loyan, I would also like to hear yours.
Yeah, so a lot of times instead of me expressing like how I felt on the inside of me, like actually telling my mom how I felt, a lot of times I would like just pick arguments out of absolutely nowhere. And then my mom is the type of person who, if she knows she's wrong, she will apologize to me, but if not, she will like scold me, and she will tell me that I am wrong, and she expects me to realize it. And a lot of times I would recognize that I was the person in the wrong, but just because I had like emotions like inside of me that I just kept inside, I just kept going. And and like especially during this pandemic, it's like especially hard because I'm just cooped up in a house all day. And but it's important that like you don't always like fight back. And my mom like realized, like when I was like just going off, she realized that I was just like rambling. I wasn't really making any sort of like points, or just because I wasn't really making sense with what I was saying, because I had a lot of things inside of me. So instead of fighting back at me and yelling at me and telling me I was wrong, she sat down with me, and she just talked with me. She gave me time to just like calm down, process how I was feeling. And she told me about, and she just talked with me, and we stayed up till like maybe 3 a.m, like talking about how I felt, because she knew that it was so important to get those emotions out. And a lot of times she just sits there, and she's always open to talk to me whenever I need it. Sometimes she even just like stops her work, or she waits for it to finish, like, and she sits there and she talks with me. And I don't really typically feel like she judges me. I know she's here just to support me, which is, I'm really lucky to have that. One thing that maybe like that isn't like so helpful is like my mom, I know she cares about me, but sometimes it's a little overwhelming. A lot of times, like after I talk with her about it, she'll want to ask like all these follow-up questions the next day or after that. And sometimes like I'm grateful that she cares and she wants to hear from me about how I'm feeling, but sometimes I I wouldn't want to talk about it, because sometimes it's like once I get it out, there isn't really much left until maybe later on, and I don't really have much to say, or I don't feel comfortable saying it. And so usually I tell her, I'm like, I'm okay, like if I need to talk, I'll talk to you like later.
Yeah, thank you for sharing, Loyan. I think what I have heard from all of you sharing that what has been helpful is to give space for emotions to be there, and to be non-judgmental and supportive, to be a good listener before giving advice. before helping fixing the problem. And another thing that I have heard from all of you saying is something that is not helpful is to not give space, right? I think a lot of times that we probably need that room to process our own emotions before we share. I think parents sometimes we need to manage our own anxiety, now pushing and give that space. I think that is something very important for a lot of parents for us to manage and to manage our anxiety to do it. So
I just wanted to interject and
yes,
just say
Linda.
that if you don't mind that, you know, it does not matter what career a person's going to have if they never get to the career. It doesn't matter what grades your kids get if they're going to take their life and never get another semester again. You don't want to be where I'm at. I'll never have my son again. I'll never have him here on this side. So all of that stuff, and I'm not casting stones because I was a type A mom that was always knowing what the next best opportunity was for my child. I was right there, you know, I knew exactly where that they needed to go, each of my kids. And none of that matters when your child takes their life. So while you have them, love your children for who they are right now, and don't make your love and acceptance of them contingent on the next goal or achievement you set for them.
Thank you for sharing that, Linda. And thank you, Sandy, Tim, and Loyan. I think this is a good segue to our Q&A section. And I would like to open up questions to our audience and have Dr. Juliana Chen and Linda and also Loyan, Sandy, and Tim join us together. And to answer those questions, we have collected a list of questions from our pre-webinar surveys. So we will try to address some of them. And I am aware that we have many questions from parents, and we're very grateful. And because of time limits, we may not be able to get to all of those questions. So if we don't, if you have any specific questions, feel free to reach out to me or Dr. Juliana Chen or Linda, and we're happy to follow up with you. Thank you. So the first question that I would like to ask all of our speakers and the panelists is something related to suicide. And a lot of students struggling with depression also have suicidality. So two questions that two parents ask here, and I'm gonna just name them together because they are very similar, is my son always says that he wants to die, but I don't know if he really means it. How should I respond? Another question is, how do I know if it is serious when my teen says that he wants to kill himself? So, Dr. Juliana Chen, would you like to weigh in on those two questions?
Yeah, no, I'm happy to, and also recognize, I don't know if Linda, you might, want to add on, but I'll start. It's obviously a big topic, but a really important topic. So I'm so glad that you're asking. So first and foremost, suicide thoughts are actually really common. A lot of people don't realize this, and they don't necessarily mean that someone is going to attempt. That being said, we always, always, always want to take this seriously. So one of those questions is about, how do I know if my child really means it? You want to take it seriously. In general, obviously, right, everything is so contextual dependent. So for context, what I mean is I would want to know things like, when is your child or teenager making these kinds of statements? Is it in the moment when they're angry and upset, and afterwards they're back to their baseline and able to say, oh, no, I didn't mean it? Or is it something they say more frequently, or something that's sticking around all the time? Also, is this something new, or has it been around for a while? Also, when I talked earlier about what depression looks like, I'd be wondering too, are there other signs that your child is struggling in some way? Is it these statements in isolation, or are you seeing mood, behavior, or functioning changes in some other way? Other risk factors are if they have tried before, if they struggle perhaps with frustration tolerance or impulsivity, if there's substance use involved, or if they're engaging in self-harm behavior in any way. And then to go back to what I mentioned during the talk, I think if the answer to any of those questions is yes, that you definitely want to seek professional help. I would also say, if the answer to all those questions is no, right? Like, oh, my kid then is fine and they've never done it before and there's no substance use or impulsivity, there is still an issue of something to assess and address, right? And perhaps it's not suicide, but it's that your child is dealing with a really difficult stressor at school or a difficult relationship, or there's someone who gets really overwhelmed emotionally and struggles with communication or frustration tolerance or just their emotion regulation. And they might need some extra support or skill building, perhaps at home or perhaps in therapy, to help them develop those skills, because longer term, the difficulty in managing their emotions or their frustration or their poor coping is likely to get in their way. So really it's like having that conversation. Everyone here talks so wonderfully and poignantly about challenges and either challenges communicating with their parents or how helpful it was when they were able to communicate. So I think that just reiterates, and these questions reiterate the importance of how open communication and dialogue are so critical. I don't know if there's more, Linda, that you might want to add on. And then of course, also the resources that we'd shared earlier are important.
Yeah, I think that if they're saying that they want to kill themselves, that is something that I would, as a parent, I would want to get checked out. I wouldn't just let that go. I would, at the very least, bring them to a mental health professional to have a professional opinion as to whether or not that is a valid threat. The other thing I want to caution you is I had a friend who took their child to a pediatrician, and the pediatrician asked, are you suicidal? Do you have thoughts of suicide? And the child said yes. And then the follow-up question was, do you have an exit plan? By exit plan, I mean, do you have a plan of how you would do it? The child said no, and so the topic was completely dropped. Mm-hmm. And as Dr. Chen said, even if there is no seriousness to that threat, there's some underlying problem there. But that certainly was not, the fact that someone doesn't have an exit plan doesn't mean that you don't take them seriously, because exit plans can be made in a split second. Walk to the train or, do something at home. So don't have that false sense of security if there is no exit plan.
Linda, thank you so much for mentioning that. I want to say, just because someone is a provider or has a degree after their name doesn't mean that that's like the end all be all, right? And I think like all things in life, a child, a teenager, you as a parent, you have to trust your gut. And if you talk to a medical professional and it doesn't feel like a good fit, or you don't feel like you're getting answers to the questions that you have, or something isn't sitting right with you, as Linda just mentioned, I think you have to follow your gut and listen to your concern, then get a second opinion or talk to someone else, because ultimately that's what the most important thing is.
Mm-hmm. Thank you for sharing, Julian and Linda. And one thing I would also like to add as a psychologist is that a lot of times the parents I work with, and they have the fear that if they ask the question, are you having suicide thoughts, it's going to triggering their kids' suicidality. I think one of the presenters, they mentioned that is not true. Asking that question will not increase their suicidal thoughts. And so feel free to ask that question. Have you thought of killing yourself? And your job is now to make a diagnosis, asking about desire, intent, or plan, any of that. And your job is, when their answer is yes, and take them to the professional service, and they will do assessment for the student. So your job is just to ask that question and be attentive to their feelings. Mm-hmm. So our next question is kind of aligned with our first question, is that I have heard many parents also asking this from the chat boxes. What would I say to my kids if they are not open to either therapy or psychiatric service or like medication, if they have any reservation about medication? So what would you say to my kids? For some parents, they are also struggling with that.
I was going to say somewhat in jest, but I think more often I'm struggling with the reverse dilemma.
The parent part, yeah.
Yeah, not to give parents here a hard time, but I think that that's probably the more common dilemma, but absolutely also have kids or teens who are less interested. And some people were just chatting this in the window and I was trying to type furiously answer. So forgive me, this is somewhat repetitive to those of you I already chatted. I would be curious, just like some of the earlier questions, I'd be really curious about reasons and context. And again, this goes back to, I'm a broken record about communication, but open communication is just the answer for so many things. It at least gives us information. So I would be curious if we could find out a little bit more about what your child's reasons are, right? Because we don't know. Is it that they didn't like that particular person that they talked to? Like it just didn't feel comfortable? Then I'd be getting a different doctor or therapist. Is it that your child has misconceptions or ideas around what medications might mean or do, or what seeing a therapist means, and they have, you know, stigma or shame or incorrect ideas about what a mental health treatment is, and then with information and answers that would, you know, open things up. So really, I think just having a dialogue maybe about what the child's reasons for the hesitation or resistance are. In a lot of the young adults here shared this, but in a non-blaming, non-critical, judgmental way, to be curious and compassionate about what those reasons are. And I think that's one way to start. For some kids, I know we're not in school right now, but for some kids, talking with a school counselor or their pediatrician sometimes feels more accessible or comfortable than seeing, you know, someone outside of those settings. And so sometimes maybe starting with a school counselor or pediatrician is another way to help. But again, it's being a little bit curious. I don't know, Wei Yang, if there's more that you'd want to add from the clinical side.
Yeah, thank you for sharing. I think one thing I'm curious if you can talk briefly about is that one of the concerns many parents have is about the side effect of medications. They're not quite familiar with what they're going to experience in that office with a psychiatrist. So can you briefly talk about medication piece and how assessments? Thank you.
Yeah, sure. No, and I also was typing furiously because a lot of people were in the chat with this exact question. Broadly speaking, this won't surprise anyone, right? All medicines, even children's cough medicine and baby aspirin, right? Like all medicines have potential side effects. So it's good that you know that, but I don't want that to scare people away, right? Like all medicines have potential side effects. It doesn't mean that we still don't consider using them because they can also sometimes be really helpful, particularly if kids and teens are really, really struggling. Each medicine or category of medicine tends to have its own constellation or group of potential side effects. So I mentioned SSRIs earlier, selective serotonin reuptake inhibitors. That is one category of antidepressants. There are actually many categories, but that is one category. And the main category, like kind of the first line medicines that we currently use for depression, anxiety, OCD, a range of disorders. So common side effects in that category of medicines are some of them are very mild. They're things like mild headache or stomach upset, sometimes maybe softening of stools like diarrhea, or can increase appetite or decrease appetite. Sometimes they can be a little bit sedating. Maybe they make you a little tired. Sometimes maybe they wake you up. But all of those effects are just individual dependent. Some people don't have any of that. Some people have it very mild and then they go away after a few days because your body just adjusts to the medicine. It's like, oh, there's this new thing. Now I'm used to it and it goes away. Sometimes those mild side effects come back with each dose increase. But broadly speaking, if a person has any side effects or any difficulty with a medicine at all, you should be monitoring and letting your doctor or nurse practitioner know. And medicines can always be adjusted. They can always be tapered. They can always be stopped. So I don't want side effects to be a reason to not consider medicines. Have those questions, ask the questions. Your provider should answer them and be informed about them. There's a lot more I could say, but I'm mindful too that there might be other questions, but hopefully that's helpful.
Thank you, Juliana. I'm also curious, I would like to open this question to our student panelists as well, because I know peer influence is very powerful. So I'm curious, what would you like to see to your peers about counseling and medication if they are struggling with mental health issues? Tim, Sandy, and Loyan.
Well, I think first of all, I was one of those groups of people who like was a little reluctant to seek help, professional help. I think I waited like a full year before I actually scheduled an appointment, even though like my mom and I had completely talked about it and had a plan for doing it, but I just kept on putting it off and putting it off. Um, I don't know exactly why, but I think I probably needed the little push from my mom, and it wasn't until she sat me down and we went together to go online and fill out the form that I went to my first appointment. And honestly, just after that first appointment, I was more, or kind of was more ready to talk about things. But I wasn't sure if I wanted to start taking medication, but and it wasn't real until I realized after taking it for a couple weeks how much it actually helped me, and especially in different social situations where before I would have had a lot of trouble to even talk to people or introduce myself. Taking the medication like reduced my anxiety by so much and allowed me to open up about my issues more and talk to other people about what I'm struggling with. And I think for me, a lot of it was having like friends I could talk to who have dealt with depression, have dealt with anxiety, and were taking the medication, that they could actually tell me about their own personal experiences and how much that it helped them.
Okay. Thank you, Tim, for sharing.
I would just like to add, before when I was probably really like maybe 9, 10 years old, I went to a therapist a few times. It wasn't, I mean, I was young, so I don't really remember exactly what went on, but I remember every time I didn't really talk about how I felt about certain things. I just sat there and I like played the little games he had in his room instead. And even now, sometimes my mom encourages me. She says, go see a therapist if you're struggling or something, because I can only do so much. And, I'm your mom, I care about you, and I can always talk with you. But, it's also nice to get some actual professional help if you're seriously struggling. Um, we never considered medications for me, but I did, and I still kind of do hold back on seeing a therapist. And I know that each patient is like, obviously important to each therapist, psychiatrist, psychologist, like whoever. But for me, it's like I'm not really sure why I hold back, but a lot of the times it's like, when you schedule a session with a therapist or whoever, once the time is up, the time is up. And sometimes, like, and that's just their job, because in my head it's like, for them, it's like, for the therapist, it's just a job. They may care about them, but there's only so much they can do. And by the time when the time's up, you have to leave. There's nothing else, and you have to wait maybe a week or however long to see them again. And I don't that's kind of what really like held me or is holding me back. But for my friends, all of my friends, whether they were diagnosed with depression, a lot of them weren't, but they still see a therapist, just, to help counsel them and so they won't develop it, or if they're feeling a little discouraged. And but usually if my friend refuses to seek a therapist, I still encourage them to, because I know that eventually it will help you. But me personally, I'm still a little like holding back on seeing one.
Mm-hmm. Thank you for sharing your story, Loyan, as well. As a therapist myself, I would say that yes, after a session, my client's time is up, but also I want them know that there's ways they can always consult with me between sessions, and that is an important part for therapists to make our students and our clients feel being accepted and safe in the counseling environment. Thank you for both of you sharing. We are behind our schedule, so we will have one last question before we wrap up. And this question is directed to Linda. And Linda, I know we talk a lot about what parents could have done differently or can do differently to support their kids with depression and suicide. So one thing that I want to ask you is that in this process, I know a lot of parents ask me when they share with me, there's that self-blaming pattern going on, or they when they lost someone and they are very critical of themselves. So what would you say to those parents who are grieving or who are blaming themselves?
Oh, thank you for asking that question. That's such an important thing to ask. The first thing is you cannot blame yourself for your child's suicide. There is no Usually there is no one reason that a person decides to take their life. And if you hold on to any of that guilt, it will mess you up. So you have got to let that go. We are not, we don't have a crystal ball in our hands. We can't see the future. If you loved your child and did your best, we're human beings. It's not ever going to be perfect. So you have to let that go in order to heal. And also it's not going to bring your loved one back. If you have other kids, you need to also, think about modeling forgiveness for yourself to your kids, so that when they make mistakes, if they think they're making a mistake, like I said, there are things that I missed. There are things that my husband missed. There's things that my daughter missed. We all saw it. But when you're grieving, you have to let that stuff go, because, it just will, it's counterproductive. And it's so important to be supportive to one another, and don't blame one another when you're going through the grief process. You're in the battle of your life, but it's not against each other. It's to get through that grief process. And grief is not the enemy. It is a way that we learn to accept the loss, and to restructure our lives with that loss there. It will never go away. I think of my son every day. So it never will be perfect again. My life has been completely changed, as well as my family's life, but life is still good, and we can go on. And our new normal is now, we can go out every day. When we wake up, we can go out and help people and be productive. So yeah, I am so sorry for anybody who's going through this loss. It is a group that you never want to be part of, but please forgive yourself, because that guilt will definitely hinder your healing.
Thank you, Linda, for sharing, and thank you for helping us normalize this process. I think, as you said, we're all human beings. We all make mistakes. We all need self-compassion. I think that's a good demonstration for our kids as well, as we all know lack of self-compassion can make us more susceptible to depression. So when you are being kind to yourself, you also help your kids to be kind to themselves and be more resilient from having mental health issues.
If they want to feel better, I even share with the world the warning signs that I missed. So you can see other parents. We all miss signs. I mean, it happens. Just let it go.
Thank you. And thank you everyone for sharing your wisdom and your stories and experience today. We're really grateful to have all of you here. I know we're out of time and we don't have time for more questions. As I mentioned, feel free to reach out to us individually if you have questions before we wrap up. And we deeply appreciate your time to take another polling and to help us to see how this webinar has been helpful and help us to plan for our future webinars. Thank you. So the polling questions will be out in any minute. It seems that our audience knowledge in those 3 areas have increased to some extent, and we are happy to see that result. And we are very grateful to have Juliana, Linda, and Loyen, Tim, and Sandy join us today and share those with us. So thank you everyone for joining us today and spend this July 4th weekend with us. And we're very grateful to have you, and you are welcome to follow up with us. We have a WeChat group that you can post the questions for follow up these discussions. Thank you for coming to our webinar today.
Thank you everyone for coming.
Thank you, everyone.
Thank you everyone for coming.